I wanted to capture the way that your body compensates for this pattern. Your pelvis is oriented to the left, and so your upper body, somewhere in the upper body, has to go to the right.
Mm-hmm.
Okay? And that's through the righting reflex. It's driven through muscles, driven through nerves, driven through the nervous system. Okay, it's a reflex called the righting reflex. And so I'm looking for that compensation, and I know that it usually happens in the upper cervical spine. And if I put my thumbs on top of the mastoid processes underneath the ear, you're more prominent on the left. If I spring it on the right side, I can cause your head to rotate right. But if I spring on the left, what do you feel?
No movement, hardly.
No movement. Yeah. I'm putting more pressure than I did on the right. Okay?
Mm-hmm.
There's also going to be a side bending component. So I have my fingers underneath the mastoid, and I'm lifting up towards me.
Mm-hmm.
Okay? I'm sitting towards my stomach, and I can side bend you to the right. And now I'm trying to side bend you, and I notice this muscle is tight.
Mm-hmm.
I can't get as deep underneath the mastoid, and I try to lift it up, and there's no movement.
Right.
Okay? So your compensation is to exaggerate it, is that your head is rotated to the right. Okay? And then your head is also side bent.
Okay.
To the right. And this will probably self-correct. When we balance your pelvis, we'll come back and we'll retest this. And because it's driven by a reflex, it no longer has a reason to exist.
Okay.
If we establish normal movement in the lower pelvis, so we'll come retest this and it'll probably just melt.
Okay, sounds good.